You know,
Yeah.
it's almost unbelievable. Imagine a deadly outbreak, dozens of people dying, and the official explanation for well over a decade was bad sausage.
Sure.
Seriously. Contaminated meat. This was the Soviet Union back in 1979. But we've dug into the real story behind the Sverdlovsk Anthrax leak for you, and trust me, it's way more gripping than food poisoning.
Oh, absolutely. What we're about to explore is really a true Cold War mystery. We've sifted through firsthand accounts, some of them pretty harrowing, actually, intelligence reports, stuff that was one top secret, and detailed scientific analyses, too.
Right.
Our mission here is to unpack what actually happened in Sverdlovsk, how the Soviets tried to, well, sweep it under the rug,
Yeah.
and what vital lessons the world has learned or should have learned from this event.
So picture this for a moment. 1979, Sverdlovsk. It was a major industrial hub in the Soviet Union, and the Cold War tension. You could practically cut it with a knife.
High stakes.
Totally. East versus West, both sides playing these shadowy games. And then, sort of out of nowhere, you start hearing whispers, rumors about a strange, aggressive illness tearing through the city. It sounds like the plot of a spy thriller, doesn't it?
It really does,
Yeah.
except this was tragically real for the people living there.
Exactly.
Absolutely.
Yeah.
And the timeline of this outbreak, it's quite stark when you look at it. It really hit hard in April and May of 1979.
Okay.
The initial information that started seeping out, often through, unofficial channels, spoke of a very rapid onset of illness and a disturbingly high number of deaths. This wasn't just a bad flu season, This was something far more serious.
And the official Soviet explanation, oh, wait till you hear this. They stuck to their story that it was all down to people eating meat contaminated with anthrax.
Right. Diseased livestock, end of story. Or so they said.
Yeah, or so they said.
And the details they offered to back this up were, shall we say, inventive.
That's one way to put it.
They even suggested that men, the heads of households, were more affected because they supposedly got the lion's share of this tainted meat.
Okay.
And then, adding insult to injury, they claimed that factors like alcohol consumption and existing ulcers made these men even more susceptible. Does that sound entirely plausible?
Not even close. It sounds like they were scrambling for any explanation other than the real one. Meanwhile, across the Iron Curtain, alarm bells must have been going off, right?
They were. It wasn't long before stories from Soviet émigrés started trickling out. But these weren't tales of dodgy burgers, like you said.
No.
These were accounts of a major accident at a biological warfare institute, right there in Sverdlovsk, and the number of deaths they were reporting, anywhere from 40 to 60 people. That's a huge difference from a few cases of food poisoning.
A massive difference, 40 to 60 versus bad meat. Okay.
That dramatic discrepancy is precisely what grabbed the attention of Western intelligence agencies.
Yeah.
The CIA, the DIA.
Right.
Now, initially, you have to understand there was some skepticism.
Okay, why?
Well, the thinking was sort of, if the Soviets were indeed developing biological weapons, wouldn't they also have developed effective ways to counter them, like vaccines or treatments?
Makes sense. They wouldn't unleash something they couldn't handle themselves.
That was the assumption. Plus, the lack of hard, verifiable evidence at that early stage also made it difficult for them to reach any, definitive conclusions.
But that changed, didn't it, as more pieces of the puzzle started to emerge?
It did. That skepticism began to fade. By early 1980, U.S. intelligence was definitely leaning towards the theory of a biological weapons accident. And when you look at the circumstantial evidence they started compiling, it's pretty hard to argue with their change of mind.
Okay, so what kind of evidence are we talking about? What were the clues?
Well, what's fascinating is how these seemingly unrelated details started to fit together. First, the Soviets deployed military forces to manage the outbreak.
Military forces. For bad meat. It seems like overkill.
Exactly. Is that a typical response? Probably not. Then there was the intense secrecy surrounding the exact nature of the illness. They weren't exactly sharing medical information openly with anyone.
Okay, secrecy, military involvement. What else?
And here's where it gets really intriguing. The pattern of the outbreak itself. That was a huge clue.
How so?
It wasn't a random spread of cases, you see. Instead, it formed this very specific narrow plume, almost like something carried by the wind, stretching southeast from a particular military compound, known as Compound 19, right past a ceramics factory.
Compound 19. Got it. And the timing?
Also highly suspicious. It affected both people and animals in that specific area almost simultaneously. What does that suggest?
Yeah.
Not really contaminated food, does it?
No, that sounds much more like like an airborne release of something nasty.
Precisely. We also have reports of a quarantine imposed by the military on the city, further isolating the affected areas.
Wow.
And perhaps most telling, civilian doctors were reportedly barred from treating the victims.
Seriously, they wouldn't let local doctors help.
That's what the reports indicated,
Yeah,
which is highly unusual in any public health crisis. Wouldn't you agree?
definitely.
And when you think about the scale of the outbreak, experts estimated that it would have taken, well, tens of kilograms, around 22 pounds of anthrax spores to cause that level of illness.
22 pounds. That's not a small amount.
Not the sort of quantity you'd find in a few dodgy kebabs, no.
So the U.S. government wasn't buying the Soviets' bad meat story for a second then?
Not at all. They tried to initiate confidential discussions, between U.S. and Soviet medical specialists, hoping to get to the truth. But the Soviets seemed resistant. It really felt like they were trying to control the narrative every step of the way.
Trying to manage the story.
That's right. There was a strong suspicion that the Soviets might have wanted the World Health Organization, the WHO, to investigate, but only under very controlled conditions.
Ah, so they could point to an international investigation, but still hide the real source.
Potentially, yes. Carefully managing what information was revealed, very likely preventing any real scrutiny of that Sverdlovsk facility, Compound 19. Meanwhile, the U.S. continued to gather intelligence, piecing together info from people on the ground. More accounts from émigrés,
And what were these accounts saying?
consistently pointing towards an accident at a special factory or a military installation in that specific area. The pieces were falling into place.
Okay, so the intelligence picture is building, but when did we get, definitive proof?
Right, well, fast forward to 1992. A really important figure enters the picture here, Matthew Meselson. He's a biologist from Harvard.
Okay.
And he wasn't entirely convinced by the initial U.S. intelligence reports. He felt they might be based on some assumptions, maybe some Cold War bias, perhaps. And he was definitely not satisfied with those flimsy Soviet explanations.
Understandable.
So he decided to investigate for himself.
On the ground. In Russia.
Yes. Meselson's trip to Sverdlovsk, which was then called Yekaterinburg again in 1992, proved to be the real turning point. His team's investigation provided the definitive evidence that inhalation anthrax was the primary cause of death for many of the victims.
Inhalation anthrax. So breathed in, not eaten.
Exactly. They were finally able to connect all the dots in a way that the earlier intelligence, while certainly heading in the right direction, hadn't fully managed.
Wow. And then there was Dr. Kanachin Elebekov, right? He was involved in the Soviet program.
Yes, Dr. Lebekov, a former high-ranking official in the Soviet biological weapons program. His account is absolutely chilling.
What did he say?
He described a filter malfunction at a military facility, almost certainly Compound 19,
Right.
that led to the accidental release of anthrax spores, just poof, out into the air.
A filter malfunction. That's mundane but deadly. How long did the release last?
He estimated it was a relatively short period, maybe just minutes, maybe up to an hour and a half,
Oh.
but long enough, clearly. And what's truly sobering, as Dr. Olybykov pointed out, is the significant role of sheer luck in this whole thing.
Luck. How so?
The wind direction. At the time of the release, the wind blew the anthrax spores away from the main, densely populated part of Sverdlovsk city center.
Oh, wow.
If the wind had been blowing the other way, right into the heart of the city, the death toll could have been catastrophically higher. We're talking potentially thousands more lives lost.
Just based on which way the wind was blowing.
Exactly. Not because of robust safety measures, but due to a chance shift in the wind. That's a chilling insight into the randomness of such disasters.
Absolutely chilling. Okay, so Messelson's trip, Alebekov's testimony. Any other scientific confirmation?
Oh, yes. Years later, in 1998, scientific analysis provided even more undeniable evidence. Researchers conducted what's called PCR analysis on tissue samples from the victims.
PCR, that's the genetic testing thing, right?
Basically, yes. It's a sophisticated technique that allows scientists to detect the genetic material of organisms, like the anthrax bacteria, even in tiny samples. And what they found confirmed the worst fears. The victims were indeed infected with virulent Bacillus anthracis, the dangerous kind.
Unequivocal proof.
Unequivocal. And what's both fascinating and deeply disturbing about the PCR analysis is that they discovered multiple Bacillus anthracis strains in different victims.
Multiple strains. What does that mean?
Well, it suggests the exposure wasn't from a single uniform batch of anthrax. One likely explanation is that the live spore vaccine being used by personnel at the facility, or perhaps being developed there, contained a mixture of strains, and the victims were exposed to this mixture during the accident.
So the stuff they were working on, possibly even a vaccine, was what leaked out.
That seems to be the strong implication, yes.
So with all this evidence mounting intelligence, eyewitnesses, Messelson, Alibikov, PCR, did the Russians ever officially come clean?
It took a while. But eventually, yes, even the Russian government had to acknowledge the truth, at least partially. In 1990, an article in Literaturная Gazeta, a prominent Soviet newspaper then, finally concluded that the outbreak was due to an accident at a secret Soviet military biological warfare facility. They referred to it as Garrison 19.
Garrison 19, Compound 19, same
It
place.
seems highly likely, yes. But even then, in 1990, there were still reported attempts to downplay things, to kind of manage the narrative, cover up the full extent of what happened.
Still trying to control the story, even years later.
It really underscores a critical point. Secrecy in public health crises just breeds mistrust and hinders effective responses. It ultimately endangers more lives.
And Compound 19 wasn't just some rogue operation, was it? There was a bigger program.
Oh, much bigger. To truly grasp the scale of the Soviet deception, we need to mention biopreparat.
Biopreparat, what was that?
This was essentially a clandestine arm within the Soviet system, a vast network of seemingly civilian research institutes that were, in reality, centers for developing biological weapons. It was huge.
So hiding in plain sight, basically.
Exactly. It highlights the systemic nature of their biological weapons program and the extreme lengths they went to conceal it. Sverdlovsk wasn't an isolated incident in terms of the program's existence, just in terms of the scale of the accidental release.
So bringing this all together,
Yeah.
what does it all mean? What did the world learn from this tragic event, and why does it still matter today?
Well, the Sverdlovsk leak is just such a stark reminder, isn't it, of the absolutely critical importance of transparency, especially when we're dealing with public health crises.
Right.
The Soviet Union's initial secrecy and outright disinformation, it didn't just hamper the immediate response on the ground. It also fueled significant suspicion and mistrust on the international stage for years.
Yeah, you can see why.
Absolutely. And it also underscores the inherent and very real dangers of secret biological weapons research programs, the potential for accidental releases, even with what people think are robust safety protocols. It's significant, and the consequences can be truly devastating.
And this Sverdlovsk incident was a violation of international agreements, wasn't it?
A clear violation, yes, of the 1972 Biological Weapons Convention. That's the international treaty designed specifically to prohibit the development, production, and stockpiling of such weapons, which the Soviet Union had signed.
So they signed the treaty but kept the program going in secret.
It appears so. The Sverdlovsk leak blew the lid off that, at least for those paying close attention.
And anthrax itself, you might think of it as something historical, but it's still around, isn't it?
Sadly, yes. It's not just in the history books. Even in recent years, we've seen outbreaks in various parts of the world. Russia, Croatia, Romania, Kazakhstan, Kyrgyzstan. It remains a persistent threat, often naturally occurring in livestock.
And it affects people in different ways. You mentioned inhalation anthrax in Sverdlovsk.
That's right. It's important to remember anthrax can manifest differently. There's cutaneous anthrax through skin contact, which is the most common naturally. Then inhalation anthrax from breathing in spores. That's what happened in Sverdlovsk, and it's particularly dangerous, often fatal.
Okay.
There's also gastrointestinal anthrax from consuming contaminated meat, ironically, the original cover story. And even injection-related anthrax, typically seen in intravenous drug users sharing contaminated needles.
So multiple routes of infection.
Yes. And the ease with which Bacillus anthracis can be grown in labs, plus the resilience of its spores can survive for decades in the environment, makes it a continuing concern in the context of potential bioweapons.
Which brings us back to that scary possibility. The ongoing concerns about Bacillus anthracis as a potential bioweapon. Sverdlovsk really brought that threat into sharp focus, didn't it?
It absolutely did. It highlighted the critical need for strong prevention measures, robust preparedness strategies, and really importantly, effective international collaboration. We need that to prevent both the proliferation and the misuse of agents like anthrax.
So things like better security at labs, more oversight.
Indeed. Strengthening security measures for handling and storing Bacillus anthracis cultures, ensuring strict oversight of research facilities, having robust surveillance systems in place to detect outbreaks early, all absolutely vital to mitigating this ongoing risk.
And working together internationally.
Crucial. International cooperation, sharing information. That's key to preventing the spread of bioweapons technology and ensuring a coordinated global response if, heaven forbid, something were to happen.
So to wrap things up then, the Sverdlovsk anthrax leak, a truly tragic event, initially hidden behind this wall of Soviet secrecy and disinformation.
Hmm.
But ultimately, the truth did emerge, revealing a devastating accident at a clandestine biological weapons facility. It serves as this chilling, stark reminder of the very grave dangers associated with such programs
Yeah.
and the absolute necessity of transparency when dealing with public health emergencies, no matter where they occur.
Well said. And maybe a final thought to leave people with.
Hmm.
Consider the truly chilling implications of just how close that Sverdlovsk outbreak came to being a much, much larger catastrophe. Just a change in wind direction.
Yeah.
What other secrets might still be hidden out there
Mm.
in various parts of the world? And how can we, as a global community, better ensure that events like this are never repeated? Furthermore, what fundamental responsibilities do nations have to be transparent about research that carries such potentially devastating risks? Well, it's a lot to consider, isn't it?
It really is a sobering story with lessons that are still incredibly relevant today.